watching the front row. I'm speaking to the CAS Ministry of Health, Dr. Mercy Mwangangi, Dr. Victor Ngani, Medical Director, RFH Specialist Hospital, and Professor Xen Iraki, an Associate Professor at the University of Nairobi and an economist. Professor, you left it off at the government should reconsider some of the stimulus packages. We're talking tax, we're talking VAT, just to ensure that we cushion Kenyans, and especially now for the next 6 months. But this very government is broke. This very government is cash-strapped. They're looking at all manners of ways to, collect taxes and make money. Are we in a situation where they're caught between a rock and a hard place, where on one hand, things have not really taken shape or gone back to normal for a lot of Kenyans, but they have to make these decisions for the country to collect some money. And on the other hand, the economy is doing very badly. They have to do this.
I don't think that things are as dire as you project. Things are not that bad. I told you that Kenyans are very resilient. Now, I think we need to become a bit more pragmatic, because there are some things that we think cannot work, but they might work. For example, if you reduce the tax rate from 16% to 14%, everybody will assume that you are going to collect less tax. But surprisingly, you might collect more tax. And that is why, as an economist, I'm so happy about the stimulus packages and the decision the government is making, because that is a free experiment for us. So just because you have reduced the tax, you have increased the tax rate, does not mean that you are going to collect more tax. On debt, I don't think that the government is broke, because all over the world, the government borrow money. I've always argued borrowing money is not a problem, it is what you do with it. So maybe apart from reducing the tax rates, the government can also reduce waste. For example, because now we don't have a lot of travel abroad, the government must be saving a lot of money from the people who travel abroad every now and then. And that money can be put into better use. But I think my biggest concern today is there is so much politics in this country. The economy is not going to recover efficiently fast enough when we have so much politics. I think we need less politics and more focus on economic issues. And at the end of the day, it is you and me who grow this economy, or the leaders. So I'm even surprised that we can emulate leaders when they go for political rallies without masks. But you know very well that if you get sick from COVID, you're on your own. But our leaders mostly have very good medical cover. So I think it is time our leaders inspired us so that we work harder, we produce more, we become more productive, the economy grows. Because at the end of the day, it is not one of you or one of us, it is all of us. So I think there's a lot we can do. We should not be very pessimistic that the economy is in doldrums. I've seen us come away from even worse episodes. I remember we had World War I, World War II, we had the epidemic in 1918, and we recovered from that. We had recession sometimes in 1990s, we recovered from that. So I think what we need to do is to inspire people to see that things will change. We are in COVID, all of us, nobody caused it, and there's no need of giving up.
Well, one would ask for not just inspiration, but action from government, and you've enumerated what you expect to be done. And still on those money matters, Dr. Mwangangi, I know you spoke about this yesterday on a show on the station as well. Kenyans are a bit jittery when we talk about the 4 million vaccines that you say will start coming in at the end of this month. When we're looking at our economic situation in this country, do we have the money to, one, procure, import these vaccines, and two, to redistribute them to the population?
Yes, one, it's important to note that Kenya has been deploying different vaccines for many, many years, and really have perfected the art of being able to marshal a vaccination campaign and deploy vaccines. And perhaps the Prof here would agree with me, the benefits of vaccines and, you know, the cost effectiveness, the cost-benefit analysis of deploying a vaccine is immense. It gets us back to work faster, it ensures fewer of us are sick, and it's a good thing. So in terms of the COVID-19 vaccine, Kenya is benefiting from what we are calling the COVAX facility. And we've come together with different countries and been able to procure a set number of vaccines, therefore leveraging on economies of scale. And we've done this through what we're calling a co-financing agreement. So Gavi has been able to support us with a set number of doses for 20% of the population in Kenya. This is about 11 million doses. And these are underway and will be coming in sort of interval stages as we continue deploying the vaccine rollout plan. And then the other proportion of the vaccination plan will be financed by government through support from different multilateral development banks, such as the World Bank. We're also talking to Africa CDC to be able to marshal more resources for this vaccine drive. The hope is that by the end of June 2023, that 40% of us will have been vaccinated. That's about 18.8 million Kenyans will have received the COVID-19 dose. In terms of the resources, I'm happy to say, as it stands right now, the resources are not a problem. We've been able to secure those resources, and that's why we keep saying that our doses are on the way. When we look at the logistic framework, when we look at particularly cold chain, I think many of us have heard people talking about this vaccine requiring certain temperatures for it to be able to be stable and, effective. Kenya, luckily, has been able to deploy, numerous vaccination campaigns. And so, yes, we do have infrastructure, and we are leveraging on this infrastructure and using it. We have a lot of cold storage capacities when it comes to temperatures of between 2 to 8 degrees. We are looking particularly for the Pfizer vaccine to be able to have, -70 infrastructure. That we do not have, but we're looking to see where best can you deploy such infrastructure should we be able to bring on the Pfizer candidate as one of the vaccines that we are utilizing. And in terms, of course, where can you get the vaccine, which facilities will be offering these vaccines? The vaccines will be available in public and private health facilities. And in terms of our rollout, phase 1, which will be running towards, this financial year. Phase 1 anticipates to cover about 1.25 million Kenyans. These are the ones that we're going to start with, and this will consist of our frontline healthcare workers, our immigration staff, our teachers, our military, our police force, as well as, people who are in religious teaching institutions. That's going to be the primary focus for the next 6 months or so. And, this 1.25 million Kenyans will be able to access these doses in close to almost 400 health facilities. And so that means there's a lot of work happening right now to ensure that, one, stakeholders are mobilized, that our healthcare workers are taken through the different capacity materials that they require to understand in terms of how to give the vaccine, that the communities are aware, and that we are ready. And so what we are seeing is that phase 1, by the end of that, we should have captured our 1.25 million priority healthcare workers and frontline workers. And then we'll get into phase 2. And of course, these phases will keep running concurrently. And in phase 2, we'll be targeting you, the Kenyan, who is over 50 years of age. We'll be targeting you who has a chronic condition, any illness, diabetes, hypertension, cancer, renal disease, HIV, TB. We'll be focusing on that cohort of people. And, we have estimates of close to 4.5 million such people who will be rolling through in terms of phase 2. And then, of course, phase 3 will include then, looking at people who live in congregate settings. We'll get into our prisons. We'll get into the refugee camps. And that's how we foresee in terms of rolling out the plan. Of course, all this is dependent on vaccine availability. This is also, of course, dependent on, what happens in terms of the new strains, in terms of any changes. Remember, it's a new disease. It's something that, really the whole world is dealing with it, and we are sort of learning as we go. But that's the plan that we have. We are ready. In fact, very impressed with the teams who are working on this. We have multi-sectoral steering agency teams. We have collaborations with the Ministry of Education, Interior, and Health, of course, all working to ensure that this vaccine plan is successful. Right. And what we need, perhaps, is then for you, the Kenyan, to present yourself when we call you, to be able to come forward and receive the vaccine.
Okay, fair enough. You've extensively covered that, and we have about 10 minutes to go, so perhaps we can begin getting the closing remarks. I'll be taking a look at a number of views, but before then, Dr. Ngani, even as we wrap up this conversation on whether perhaps it is time for us to reconsider some of the restrictions we've made, do we expect any new trends from where you sit?
Well, indeed, I would fully support what Dr. Mwangangi said. I think the next 3 to 4 weeks will be critical to tell us what direction we are taking, and I think from there we will be better informed. And if there will be a major surge, the whole country will know. I think it's important for us to trust the data that's coming through. Yes, it does correlate clinically with what we are seeing in the hospitals. The diagnoses are fewer, and we have fewer admissions, but then again, the trends could change from time to time. It's crucially important to protect those that Dr. Mwangangi enumerated, those who are of advanced age, those with chronic illnesses, because this is a cohort of people who get a very critical disease. I would urge largely that despite what we've seen in the last few months, I think I've said this before, I'll just maintain it, that we ought to be extremely careful not to let this get out of hand. Mm.
So then, even as we spread caution, and even as you talk to us about how critical the next 2 or 3 weeks will be, what do we expect from the population and the leadership in this country?
Well, I think what we've seen is very different from what we would be talking about in terms of expectation. And speaking from my personal observations, I think the leadership, the political class, have not been very supportive of the anti-COVID initiatives. I think we are seeing way too many rallies, way too many unnecessary gatherings, and the population has sort of followed suit. We are seeing fewer and fewer people wearing masks. It becomes sort of something that we are not doing. We are seeing people interacting with older people. And again, Akisa, I say, if you've seen what we've seen, you'd probably understand why it's best to protect our parents, best to protect those who have chronic illnesses. It's not a fair disease in this way. Perhaps when the vaccine comes across, then there'll be a lot of hope. And it's true, the cost of vaccination is way less than the cost of treatment, especially in the COVID-19 scenarios. So even if you were, resource restrained in a way, would still focus on this particular area. Our hope is that we get to a point where a big proportion of the population is going to be vaccinated, and as such, then combined with the natural transmission, we have herd immunity. Of course, the concern is when we hear the CAS mention correctly that globally we are targeting 40% of the population by the year 2023, then you understand we have quite a long way to go before we can achieve herd immunity through vaccination. This is not a problem unique to Kenya. I think it's a problem globally, and Kenya is indeed doing very well to be able to access more than 1 million doses of vaccines within this first half of 2021. All
right, Prof, let's get your closing remarks on the whole conversation. And when we're looking at the economy, you've spent a considerable amount of time talking to us about what then should the government do to ensure that they continue to cushion Kenyans. But what should Kenyans do?
Thank you. The economic recovery is not just about EMU, although we must do our part. I think it goes beyond individuals to a lot of cooperation. For example, it is the time counties started talking to each other. When we talk about recovering from COVID-19, I believe counties can share a lot of resources, whether it is medical resources, whether it is transport, there are a lot of resources they can share to reduce the costs. Nations must also cooperate with each other. I think it's a high time we leverage on East African community so that as we recover from COVID-19, we help each other, we learn from each other. Even at the global level, the time countries stop behaving like islands. I think Dr. Mwangangi will tell you that one of the problems that we faced when COVID came ashore, when we got COVID-19, is that a lot of countries started behaving as if they are the only countries. Cooperation was not as expected. If you look at past pandemics or past problems like Ebola and so on, there was global cooperation. So when countries don't cooperate with each other, they suffer individually. So I expect more cooperation as we recover from COVID-19 at the global level, national level, county level, and everywhere. What I'm sure is that we are going to recover from the economic crisis that is caused by COVID-19. I have no doubt about that, because in the past, we have recovered from such crisis. All we need is to be patient, Each person does his work as an individual, the governments, national, county, the global multilateral organizations. Each person should do his work because we cannot afford to give up. That's not the nature of human beings. Even the variant we are talking about, I can tell you within the next few months, it took 1 year to come up with a COVID-19 vaccine. And I can tell you within the next few months, we are going to come up with a vaccine that is going to deal with the new variants. Human beings have always been hopeful, and we cannot stop being hopeful. That's what has made us a superior being compared with other animals on this small planet. Thank you.
Thank you very much. Let's get the last word here from the CAS Health, Dr. Massimo Ngangi. I would not let you go without asking this question. Are we in any way considering, as a government, are we reconsidering some of these stringent measures against COVID-19, like the curfew? Is it in the books?
Akisa, the restrictions continue and will continue to remain in force up until the president pronounces himself. We do continue to update him and offer, technical advice in terms of the situation, in terms of how the curve looks like, in terms of admissions and people on oxygen. So this information is being collated and transmitted to him. However, the important thing is that we already have restrictions and we need to adhere to them. I think if there's anything, that we should take home from our conversation tonight is that we still need to be extremely cautious as a country. And so the restrictions remain. That decision will be made when the time comes for it. You did clearly state that we have perhaps a month to 12 March when we then make the next announcements. And so let's continue adhering to these restrictions. Let's continue adhering to these measures. And most importantly, let's be proud of who we are as Kenyans. We are resilient. Let's move along with this. Much like Prof has said, hope is very important. Let's not be so despondent. It will not help us. It will not help us, and I'm talking as a doctor, it will not help us. Talking as government, we need to move forward and continue perhaps adapting into our current circumstances and look into a brighter future. Thank you.
All right, thank you. We wait for March 12th when the president will give the next set of directives, hopefully for the bigger percentage of you who say that the lockdown or the curfew rather should be reconsidered. Let's wait to see what the president will say. Earlier on today, the Ministry of Health sent out circulars to the counties to be on high alert. Let's take a look at that as we wrap it up here on the front row. The circulars that was sent to the counties for them to just be on a high alert. And there we go. We'll not read everything, but the counties are just being asked to remain vigilant, be on high alert. That's more than, of course, the numbers that have been reported globally. And Kenya confirmed the first COVID-19 case on 13th March 2020. To date, 101,819 cases have been confirmed. They're talking about the recent global emergence of the new SARS-CoV-19 variants and a surge of cases in some countries in the region. Kenya remains at high risk of importation of these new variants that could potentially instigate a resurgence of cases and deaths. The new variants seem to be more transmissible, but there is still no evidence that they cause more severe illness or increased risk of death. A rapid increase in the number of cases will put more strain on healthcare resources, leading to more hospitalization and potentially more deaths. So this is what the government is asking the counties to do. Let's just quickly go through what are some of the measures that the counties have been asked to take with regards to the concern globally over the new COVID-19 strains that are being witnessed in a number of counties, as I mentioned earlier, in the UK, in South Africa, in Japan. They are being asked to enhance surveillance up to the household level to promptly identify COVID-19 suspected cases with history of international travel and also detect this. And of course, we'll continue to give you more details on this as the circulars. Enhance cross-border disease surveillance activities, including sharing information between border sub-counties and the neighboring country districts. Reactivate rapid response teams and facilitate them to respond timely to all the alas. This is what the ministry is asking the county governments to do: strengthen laboratory capacity for specimen collection, shipment and timely information, and scale up risk communication, community engagement activities to enhance awareness on the public health implications of new variants to the public, and emphasize the importance of maintaining ongoing preventive measures to minimize transmission. You will be seeing your counties perhaps engage in this. Is a circular from the Ministry of Health. And of course, that's how we wrap it up here. Thank you for joining us on the front row. My guest on this episode, Dr. Masi Mwangangi, the CAS Ministry of Health, Dr. Victor Ngani, the Medical Director, RFH Specialist Hospital, and Professor X.N. Iraqi, an economist and associate professor at the University of Nairobi. Gentlemen and lady, thank you for joining us. And you at home for joining us, contributing, asking questions. Till next time, I am Akisa Wandera.